Welcome to the 2022 Lake County Community Health Needs Assessment presentation. My name is Joe Rombo, an epidemiologist with the Lake County General Health District, and I will be your presenter today. Every 3 years, we conduct this set of 4 assessments to assess the health of Lake County. During 2022, we've conducted all these assessments according to the MAP process, or the Mobilizing for Action through Partnerships and Planning process. This presentation covers the Community Health Status Assessment. We refer to it as our Community Health Needs Assessment. A little bit of background: health departments and nonprofit hospitals are required to assess the health of the community and identify strategies for health improvement every 3 years. Previous community health needs assessments and community health improvement plans were completed in late 2019 in collaboration with Lake Health. In early 2022, University Hospitals and Lake County General Health District, with the support of the Community Health Needs Assessment Steering Committee, guided the 2022 CHNA process. The purpose of the needs assessment is to identify and prioritize significant health needs of the community in Lake County, Ohio. The priorities that were identified in the Community Health Needs Assessment help to guide community health improvement programs and community benefit activities. Through this criteria, 9 needs emerged as significant. So looking at a combination of our collection of secondary data and data collected from surveys and focus groups, these were the 9 greatest health concerns. We'll look at these in greater depth during the rest of the presentation. A little bit about the Community Health Needs Assessment process. So the Lake County Community Health Needs Assessment was performed by the Lake County General Health District and UH Lake Health Medical Centers. Data collection activities included a collection of 171 secondary data measures from nationally recognized and publicly available data sources, distribution of a survey to current Lake County residents in both English and Spanish languages, distribution of a survey to Lake County mayors and city managers, 5 community focus groups with Lake County residents. That's for the secondary data collection. For the 2022 secondary data analysis for Lake County, demographic, socioeconomic, morbidity, and mortality data were obtained from 21 publicly available sources. In conjunction with Lake County values, 2 demographically similar counties, Licking County and Clermont County, were included for benchmarking purposes. Based upon the quality, age, availability, and or redundancy of the measures, 171 of the initially compiled 338 measures were included for analysis. The data sources used included the U.S. Census data, county health rankings and roadmaps, community commons, Ohio Department of Health Data Warehouse, the CDC wide-ranging online data for epidemiologic research, web-based injury statistics query and reporting system, behavioral risk factor surveillance system, amongst others. For the primary data collection, input was collected from residents in Lake County. Primary data used in this assessment consisted of focus group discussions, an online community survey, as well as an additional survey with mayors and city managers. One method of community input was through an online survey. A total of 1,846 responses were collected. 5 key focus group discussions were conducted to gain deeper understanding of health issues. Key community groups who participated in these focus groups included representatives from 1 Black Lives Matter, 2 LGBTQ plus community, 3 NAACP, 4 Paynesville Elm Street Elementary, and 5 seniors. The survey itself was 102 questions. Data was collected during February 2022. The link to the survey was distributed on Lake County General Health District's website, social media accounts, and disseminated to University Hospitals patients. So these are the Lake County significant health needs. The non-prioritized health needs. The following significant health needs emerged from a review of the primary and secondary data. Even though these needs will not be directly focused on in the Community Health Improvement Plan, they provide additional opportunities to grow and expand existing work as well as implementing additional programming in new areas as they arise. Non-prioritized health topic number 1, economic concerns. Economic concerns were identified as a top health need from qualitative community feedback. 5.1% of families in Lake County live below the poverty level, and 4.2% of the population 16 years and above in Lake County are unemployed. Secondary data tells us the available economic data available. Even though Lake County has a lower level of families living below the poverty level than the state, and the unemployment level in Lake County is lower than the state, these issues still arose as a concern to the community through the focus groups. At the time of this recording, Lake County has approximately 2,400 participants in the WIC program, including mothers and children. Non-prioritized health topic number 2, cancer. This was identified as a significant health need through secondary data analysis and the community survey. Breast cancer rates and colorectal cancer death rates were identified as areas of concern from the secondary data analysis. And the most common cancer diagnosis reported by survey respondents were breast cancer, skin cancer, prostate, colon, melanoma, and lung cancers. Non-prioritized health topic number 3, infectious disease. This was identified as a significant health need through secondary data analysis and qualitative data. The rate of West Nile virus was identified as an indicator of concern from secondary data analysis. This is the second health assessment where West Nile virus was identified as an indicator of concern from the community. West Nile rate The West Nile rate that was concerning was based on cases in 2018, but there were only 3 cases in Lake County. It caused the incident rate per 100,000 population, which was 1.3 in 2018, to be twice that of the state, which was 0.6. There were 0 cases in 2019, 2 in 2020, and 1 in 2021. Non-prioritized health topic number 4, built environment. This was identified as a significant health need through secondary data analysis and the community survey. There was a concentration of fast food facilities in Lake County, which was identified as an indicator of concern from the secondary data analysis. There weren't any other built environment concerns that came up given the abundance of parks in Lake County. Non-prioritized health topic number 5, unintentional injury and accidents. And this was identified as a significant health need through the secondary data analysis. Unintentional injury death rate was identified as an indicator of concern from secondary data analysis, and fall death rate was also identified as an indicator of concern from secondary data analysis. The high rate of unintentional injury is related to drug and overdose deaths, which is looked at separately in mental health and substance use and misuse. Fall death rate was also identified as a priority area in the 2019 Community Health Needs Assessment. The prioritized health needs. To better target activities to address the most pressing health needs in the community, the Lake County General Health District and UH Lake Health Medical Centers convened a group of community members and leaders to participate in a presentation of data on significant health needs. The participants were given access to an online link to complete a scoring exercise to assign a score to each significant health need based on a set of criteria. The 2 criteria that were used for prioritization of the health needs were 1, rating of what people felt were the scope and severity of the health issue, 2, the ability of the local public health system to make a measurable impact on the said health topic through new and existing health initiatives. So these are the Lake County prioritized health needs: access to healthcare, behavioral health, including mental health and substance use and misuse, and chronic disease. So prioritized health topic number 1, behavioral health. Substance use and misuse. This was identified as a significant health need through secondary data analysis from community survey respondents and focus group participants. Lake County has a high rate of drug overdoses and overdose deaths. Lake County also has a high rate of alcohol abuse and traffic fatalities involving alcohol. The smoking rate in Lake County for 2019 was 21%. So, based on the secondary data scoring results, substance use and misuse was identified to be a top health need in Lake County. And looking at the graph, alcohol-related death rate is any death where alcohol is a factor. Alcohol-impaired driving implies above the legal blood alcohol content level of 0.08, whereas the person's killed in crashes involving blood alcohol content of 0.01 or greater includes those below the legal BAC level. Excessively using alcohol is identified as at least one episode of binge drinking in the last month or regularly exceeding the recommended alcohol intake. We pulled the secondary data measures for 5 places and then the Healthy People 2030 objective target if there was an equivalent for that measure. National data, state data, are Lake County data, and 2 demographically similar counties in Lake County, in Claremont and Licking counties were included. To decide if it was a disproportionate health concern in Lake County, we then ranked all 5 or 6 of those values for each of the measures. If Lake County's value was worse than 4 or 5 of the other measures, we called it a health concern for Lake County. The benchmark score is how many of the other values Lake County was worse than. So benchmark score 5 is worse than all 5 others, or benchmark score 4 is worse than 4 others or all others for ones that didn't have a corresponding healthy people target. Here we have a graph of Lake County overdose emergency and urgent care visits in 2022. The overdoses are trending down since we started tracking this metric in 2018. And as an FYI, this data excludes suicide, intentional suicide, suicide intent, insulin as the drug for overdoses, ingestion with no reference to poison or overdosing, psychiatric evaluations, and detoxes. Prioritized health topic number 2, access to health care. This was identified as a significant health need through community survey and qualitative data. Community identified the need for healthcare providers who look like and have similar experiences to the patients they care for. Some of the key themes include 15% of respondents had not seen a doctor in the last 12 months for a routine checkup, and 7% of respondents do not have a person they think of as their personal doctor or healthcare provider. Prioritized health topic number 2, access to healthcare. The Community Health Survey asked respondents to provide insight into their own healthcare, including barriers to access. As you can see from the graph of the Lake County respondents reporting having insurance coverage by insurance type, the 2 most popular were Medicare or those who had purchased a plan through an employer or a union. Also worth noting, 3.3% of those surveyed reported not having health insurance at all. Addressing the health needs, a geographic focus. So Conduent's Health and Equity Index estimates areas of high socioeconomic need, which are correlated with poor health outcomes. Zip codes are ranked based on their index value to identify relative levels of need. Part of the assessment focused on identifying geographic areas with greater need in Lake County. Initially, this was examined by zip code, but when examined by zip code, there were several communities with vastly different needs and resources that make up zip code 44077, including Fairport Harbor, Painesville City, Painesville Township, Concord Township, and Leroy Township. For this reason, data was examined at the census tract level to assure resources and needs were best understood. The Health Equity Index illustrates greater areas of opportunity for impact in these specific census tracts. The Health Equity Index scores for these 7 census tracts are shown in the table. Prioritized health topic number 2, access to healthcare. The following figure shows the percentage of survey respondents by geography who reported needing specific services in the last year, but who were unable to access them due to cost. Dental care is the most common service that respondents were unable to access, followed by getting their prescription medications. Cost was more of a barrier for residents of Eastlake and Paynesville for medical care, mental health care, or counseling, and prescription medicines compared to the county overall. Foregoing dental services due to cost was greater in Paynesville than for the county overall. Prioritized health topic number 3, chronic disease. This was identified as a significant health need through the secondary data analysis and the community survey. The most common chronic disease diagnosis reported by survey respondents were high blood pressure, arthritis, high cholesterol, diabetes, asthma, and chronic pain. Based on the secondary data scoring results, chronic disease was identified to be a top health need in Lake County. The heart disease death rate is higher, and the Medicare population with osteoporosis, heart disease, stroke, hyperlipidemia, ischemic heart disease, and arthritis is higher than the 2 benchmark counties and Ohio. Prioritized health topic number 3, chronic disease. The Community Health Survey asked respondents to provide insight into specific illness diagnosis and care related to chronic disease. The following figure shows the percentage of community survey respondents in Lake County, Eastlake, and Paynesville reporting an illness diagnosis by a doctor, nurse, or other health professional. And as you can see, the top illness diagnoses are high blood pressure, arthritis, and cholesterol. Prioritized health topic number 3, chronic disease. Below you can see a graph of the percentage of respondents reporting number of days they were physically active for at least 60 minutes in the last week, 0 days and 7 days are the first and second greatest number of days active for at least 60 minutes within a week. Alignment. So the final prioritized health needs from this 2022 Lake County Community Health Needs Assessment are in alignment with some of the top priorities and factors influencing health outcomes from the 2020 to 2022 Ohio State Health Improvement Plan. They are also in alignment with a subset of 2019 Lake County Community Health Needs Assessment priority areas. And as you can see here, the icon with a check mark in the box indicates areas of alignment. And to conclude, this collaborative community health needs assessment leveraged data to provide a comprehensive picture of health in Lake County, Ohio. The Community Health Needs Assessment will be used to inform the Community Health Improvement Plan and used to select strategies based on the Community Health Needs Assessment priorities. The strategies will allow a work plan to be created and to set targets and work goals. There will be annual data tracking to assess the progress of the Community Health Improvement Plan. The community health needs will be reassessed in 3 years. The next steps are based on the community health assessment, annual data tracking to assess progress, and then reassess needs again in 3 years. This is a chart that shows the flow or cycle of the needs assessment to the community health improvement plan to the tracking of metrics. The community health improvement plan will allow us to make a work plan to set targets and work goals. So thank you for listening to this presentation, and I wish you all a very wonderful day.